Yeah, increasingly we are seeing evidence that looks at what the long-term impact of COVID-19 may be on an individual and on our brains. So what may be the impact on our memory, on our behavior, and our overall function. At this point, we still don't know the answers to that, but that's why the Alzheimer's Association, along with researchers at University of Texas, San Antonio, and around the world, have come together to start to collect that information so we can try to answer that question.
So what stage is that project in?
We're really at the initial stages. The consortium has been working together for the past 6 to 9 months and really developing what are the kinds of questions we should be asking, tracking the science as it comes out. We are seeing that there is an impact, for instance, on the blood-brain barrier that protects our brains. We're seeing that there's a specific immune response. Both of those are biologies, for instance, that we also see in Alzheimer's. And so how can we understand what are the questions we should be asking? What's the information that we should be collecting? And put all of that together in this study as we're developing those protocols and working with, again, these teams around the world to do just that.
So you're starting to find hints that there might be some bigger implications from coronavirus.
Well, I think it's putting forth that we need to ask those questions now. If you look at past pandemics, such as the SARS or MERS pandemic, or even the 1918 influenza pandemic, when you look at, there have been reports following those of individuals having changes in their memory and other behavioral changes that might be linked to their brain. With COVID-19, one of the symptoms that we hear a lot about is that loss of taste or loss of smell. And that's actually a sign that there's something going on with your brain. And so how that may impact long-term, we don't know.
Why is that a sign something's going on with your brain? What do we think is causing that?
I'm sorry, I didn't hear the question.
Oh,
It cut out.
how is that a sign that something's going on with your brain? What do we think is causing that?
Yeah, I mean, I think that's a big question, right? In terms of, so anytime any of our functions, so our smell, our taste, those are actually functions that are driven by our brain, by our brain's biology, by our brain. Our brains are really the command center of our entire body, and so it's anytime we have changes or an impact on our brain, that's where we might see it in some of our function and some of our outcomes as well. There is some evidence that the virus may get in the brain directly. It may cross the blood-brain barrier. It's unclear. There's a lot of, again, still outstanding questions that we need to ask and answer to really understand what that impact may be. And that's really why following both in looking in the short term, but also in the long term becomes so important.
When do we think we'll know more?
So we're starting in some of the sites that are in some of the teams that we're working with through this consortium have already started collecting data and information. But of course, it's going to take us time as we track and follow what that long-term impact may be. We hope to have some initial findings in late 2022.
So what would you tell someone who had coronavirus that might hear this and be really worried?
I'd say continue to have those conversations with your healthcare provider. There's a lot we don't know in terms of the long-term impact, but have those conversations. This is something we should be having anyway with our healthcare provider about our overall health, about where we are, and thinking about our memory and beyond, and have that ongoing conversation as you go forward. If you do have concerns about yourself or somebody in your family, have that conversation with your healthcare provider as well.
Thank you so much. Anything else you want to add?
I think the only thing I would add is that, we also know that this is a time of that can be very, very challenging for those that are already living with Alzheimer's or caring for somebody with Alzheimer's. The Alzheimer's Association does have resources on our website at alz.org. And so we encourage people to reach out. We're here for you during this time.
While I have you, I was actually working on another story for down the road about this. How is it particularly difficult for that population right now?
I think there's a lot of pieces that you can look at. So for instance, there's an increase in social isolation. There might be more challenges with having some of that help that may come in and be part of the care unit for an individual. I think that, so there's a lot of challenges around that. Individuals with Alzheimer's or any other dementia may also have behaviors that may impact their risk in terms of, hand washing and remembering proper hand washing, wearing a mask, and some of those behaviors as well.
Yeah, how hard is it to explain to someone with Alzheimer's about wearing a mask?
There's certainly, we have some tips that we've developed that are on our website, again at alz.org. But there are certainly challenges, and we, just there's so many heroes that are going through this journey each and every day, both those living with the disease, but also those providing care.